Namaste friends. Today I am going to discuss about fear and anxiety. Recently, one of my relatives, he was not feeling well, but just because of his fears and anxiety, he don't want to meet a doctor. Just even for a nearby doctor also he was not ready. Ultimately, all the relatives and all decided to take him to the hospital. And just it was a decision to do all the blood checkup. No conclusions or nothing was there. Doctors decided to do all the normal investigation reports and advised him to stay in a hospitalization. But before that, he just by seeing that setup, the hospital environment, or by the relatives, and you all know how is the environment of the hospital. Just by that environment or what, he just collapsed there. During this COVID pandemic, the main thing is fear. Many research articles, many papers are coming, but we need to overcome it. Those who are taking care, they are taking very extra care. Those who are not taking care, they are simply not taking care. So this during this phase of COVID-19 pandemic, global pandemic, we need to keep much patience, fear, and positive thinking. The power of patience acts as a vital element to cope with stressful situations. Owing to fear and anxiety often occur concurrently and symptoms typically overlap. These terms are interrelated. A person's experience with this emotion differs based on their context. A key difference between fear and anxiety rests in the nature of the threat as well as physiological elements during experiencing this condition. Fear relates to a known or understood threat, whereas anxiety follows from an unknown, unexpected, or poorly defined threat. In other words, fear is the result of real threat or impending danger, and anxiety is a result of perceived threat or anticipation of future threat. Naturally, fear and anxiety are normal reactions to the stress, especially when people have to deal with crisis movements or unprecedented events. Fear or anxiety result in the expression of a range of adaptive or defensive behaviors. During the pandemic of COVID-19, fear and anxiety should not be concealed since it might potentially lead to chronic stress, putting people at greater risk of developing mental illness. The fight or flight response is a physiological reaction that occurs in the response to a perceived harmful event, attack, or threat to survival, especially when fear or anxiety happens. The fight or flight response prepares the body for a fast paced action, whether people choose to flee or fight. It's our choice what we will do. Their body will need all of its resource. The evolutionary response is triggered by the release of hormones epinephrine, adrenaline, and cortisol into the bloodstream. These stress hormones cause several physiological changes in the body, including an increase in the heart rate and blood pressure. During experiencing the fight or flight response, people develop palpitation, describing as having fast beating, fluttering, or pounding heart, tachypnea, rapid breathing, resulting in discomfort, tightness, and unrelaxed feeling. Nowadays, many young ladies within the 35 to 40 age group, they have started with the BP tablets. Initially, earlier it was anxiety, and that has converted into the BP. Many new cases are coming to me, and the BP tablets are started. So, just if you are able to understand your emotion, what is fear, what is anxiety, and if you keep a patience, first you identify there is a no wrong to have these reactions. We all are human beings, so it will happen. Other changes that take place in the body also include chest discomfort, nausea and vomiting, dizziness, vision impairment, and numbness or tingling in the certain parts of the body. Most of the times, these symptoms concurrently and rapidly happen. People often mistake these stress induced abnormalities for other serious diseases, such as cardiovascular, neurological, or gastrointestinal disease. But the main thing, the main line factor is anxiety and fear. During the crisis, this reaction might occasionally happen from time to time. After the critical movement ends, these reactions are supposed to become diminished. On the contrary, if these reactions have unpredictable continued without control, it can result in impaired mental health that largely interferes with daily life activities. Getting over concerned with health status, well-being, food hygiene, and safety lead to high degree of difficulties faced in the daily life. Anticipation of uncertain future threats or danger substantially induce panic attack. And panic attack is a sudden episode of intense fear that triggers severe physical reactions when there is no apparent cause or real danger. In spite of the fact that panic attacks can be frightening, stress reduction plays a vital role in panic prevention. To cope with stressful situations, a one size fits all approach might not be able to apply since everyone deals with the stress and anxiety in different ways. General statements such as do not worry and stay relaxed might not be practical advice in this critical time. In point of fact, it might sound unrealistic and impractical, indicating less concern for this matter. So it's advisable to communicate with your loved one or with your doctor or with someone that they can help you. Even if you do some technique, it may not be like breathing technique or anything, it might be very difficult. So during this crisis I request that everything should happen well. See, this is the one phase we are going. So maintain proper social distancing, wear mask, keep your hand wash, and any near people around you, if you feel, if you talk to them and they are comfortable, you talk to them. Or if they required any medical help, give them a medical help, maybe allopathic, homeopathic, or ayurvedic. But overcome these attacks of fear, anxiety. Keep patience. Stay home, stay healthy. So, signing out. Bye.